Thanks, Ceann Comhairle. I think obviously the right to health is one of the most basic human rights that any citizen would aspire to. I think our ability to access it in this country is far too much tied up in our ability to pay and the amount of money that we have in our pockets. And, you know, I've just come from a very heartbreaking press conference of parents of much wanted children who were diagnosed with a fatal fetal abnormality, who have launched this afternoon their petition to the United Nations in relation to a violation of their human rights in this regard. But one of the women made the point to me at the end that her little girl, who was born in the summer with a number of serious health problems that require ongoing care and attention, that they were just in the last couple of days denied access to a medical card. And when people are struggling enough to care for their loved ones or themselves, the idea of being dragged back down by financial considerations or bureaucracy, to me, is just abhorrent in anything that would claim to be a civilised society. Now, the Minister made the point in his opening remarks this morning that the changes that are being discussed here, that nobody who is entitled to a medical card is going to lose out by the changes in the legislations before us. Now, I reject that way of putting things, because you can change the rules on anything to change people's entitlement, and an entitlement is something in some ways that can be spun as being very different than saying that everybody who needs it is going to get it. And I think that should be our starting point, is need rather than entitlement, because entitlement, to my mind, introduces a certain element of an insult, that some are entitled and others aren't. If you need medical care, you should be entitled to access it, irregardless of your financial means. And you see, I think the problem of what the government here is that the goalposts are moving all the time. We have a scenario now, obviously, in this legislation where the gross income limit for over 70s to get a medical card is being changed to €500 a week for a single person. We have to say it was 600. Before that, it was 700, and what we're in effect talking about here is the cumulative impact of a reduction of almost 30% over the last 2 years. And for couples, as Deputy Fleming highlighted, the situation is even worse, where they're experiencing a reduction of over 35.71% over the 2 years. And I think the Minister has actually a social obligation to address the anomaly and the discrimination that has been introduced into this measure in relation to couples, because it just doesn't add up for anything else. In any other scenario, a couple are taking to be double the income limit of a single person, but not content with that. In this scenario, the government have reduced it to €900, and I've had correspondence from citizens who, had it been the doubling of the single allowance, as every other social welfare payment is, and had the bar been set at €1,000, that they would still be able to access a medical card, but because of this sneaky manoeuvre, even on the basis of the cuts, they're going to lose out now. And certainly at least one couple in my area highlighted the fact that this probably meant that the wife in the relationship, who has a serious lifelong medical condition, that they're not going to be able to access the medical care that she needs through the GP and the medical card, and she'll probably end up in hospital and on a much more serious drain on the state. And I think what we're doing here is a little bit like our pension system, and it actually goes against the whole ethos of what the government says it's trying to do in terms of access to healthcare. And the idea of universal payments, to me, is something that's far more administratively efficient, and it's far more equitable as well, because when people are working and earning in their early or middle years in their life, if they're earning big money, they should be taxed on that income. But all citizens, when they reach an older age, should be entitled to access medical care, and clearly this measure is designed to remove many people from that loop. I think we need to see it in the context of living standards of pensioners as it is already, and a lot of play has been made about, oh, they haven't really been touched up to now, an analysis which doesn't bear any backup at all. But we have a scenario in this country where 80% of our pensioners live on the majority of their income comes from the state pension. Now, that is a phenomenal figure. What it is, in effect, means that 80% of our pensioners, most of their income comes from the state pension. It's a very limited amount of money. And yes, when you get to that age, you mightn't have a mortgage or whatever, so your outgoings are somewhat less, although a lot of pensioners now are obviously subbing their sons and daughters who can't make ends meet, but they're not living the high life by any means. And it is going to be, apart from an individual cost to these citizens, making people more cautious about their health care, slowing down on measures which could get them an early intervention is, in my opinion, inevitably going to cost the state more in the long run. And I think we are contributing to an idea of undervaluing elderly citizens or retired citizens, which I think is a disgrace. I think other deputies have highlighted the points that the regulations of the gross incomes don't take into account the costs of those with special health needs and all of the extra costs that go with managing particular health conditions, be it increased heating at home, the need to buy special food, the need to maintain special medical equipment, or so on. I think we've got to see it as well with the other cutbacks that have come, like the second increase in the prescription charge from 150 to 250, which, you know, it's just not good enough that the Minister for Health can, when he's an opposition spokesperson, say, vote for me and I'll abolish prescription charges, and then he comes into power and he increases them not just once but twice. I mean, this is an absolute betrayal of the electorate. Medical cards are not a handout. They're a benefit that were fought for and paid for by workers during their working life through the PAYE and PRSI that they have paid, and withdrawing them at a time in their life when they're most likely to need them is just a bit of a roundabout economics, and I think it is in essence attempting to scapegoat elderly citizens as if they were the ones who caused the crisis, because this is all about saving a few bob at their expense. And when you consider the measures that the government failed to implement that would have allowed you to generate a lot of extra taxation by tackling a wealth tax, for example, dealing with the issues of corporation tax, increasing the amounts of income tax on those earning six-figure salaries, all of that would have enabled you to generate extra revenue. Instead, this bill here before us is to go for the soft touch, and it is going to have an impact on well over 100,000 people, and is going to have an impact on the communities as well. And I do think, apart from prescription charges and other cutbacks, we need to look at the whole area of the cutbacks in home help hours as well. In actual fact, what we have short-term austerity measures which are ending up and going to cost society far more in the long term because we don't grant this concession now. And I just want to maybe deal briefly with the issues that have been highlighted by many of the organisations which deal primarily with care for older citizens. And I think Age Action Ireland have in particular played an invaluable role in that regard. And what they have paid particular attention to is not just this measure here before us, but the cumulative and multiplier effect of rising costs and undermining health services as a combined product, if you like, of the years of austerity and the financial pressure that has put on people, and it just has to be taken in that context. And I'll just quote a bit from it. They talk about the ability to phone family and friends is an important link, said one of their workers. This cut will drive people into further isolation, will contribute to greater stress on our health services, and will ultimately cost more money than it will save. The longer people live in stressful economic and social circumstances, the greater the wear and tear they suffer, the less likelihood they are to enjoy a healthy old age. As one ages, the risks of health problems deteriorates and increases, and so on. And I think the key issue here is that prevention is better than cure, and all of the measures that we can put in place as a civilised society to raise the living standards of elderly citizens, to allow them access medical care when they need it, regardless of their ability to pay. These measures not only deliver a healthier population, they also save society far more money in the long run. And to me, you've got things completely the wrong way around. This is an austerity measure targeting the most vulnerable, and will cost society in the long term.